We're going to go back to the phone lines. I've got Sandy from Long Beach. Sandy, welcome to the show. Do you have a question for Dr. Yu?
Okay, so how did you wear your knees out? Well, where did you do your bodybuilding at? Like at a traditional gym? Oh. Your dad didn't train, he didn't train with Arnold, did he? Oh, but you actually knew him then, huh? You actually knew him though, huh? Okay. So, what were you diagnosed with your knees? Were they torn meniscuses or did you have arthritis? Okay. So, and did you want to avoid the arthroscopic surgery for the meniscus? Okay. Yeah. So, the problem with arthroscopic surgery, what they do is they actually, it's not really a repair of the meniscus, they actually cut it out. It's a meniscectomy, and that temporarily relieves the pain. But the problem with that is the purpose of the meniscus, it helps stabilize the knee. And if you cut it out, the knee becomes weaker and less stable, and then eventually it wears out faster. And then once it becomes bone on bone, then they're going to have to do a knee replacement. Okay, so what we do is we do a couple things. We do laser guided stem cell therapy. We have one laser that's an infrared thermometer, and it helps detect where the inflammation is greatest in the knee. Like we could determine, is it the inside meniscus, the medial or lateral, and then that'll help us determine where to put the stem cells, because the stem cells home in on the area of greatest inflammation. It's called cytokine signaling, and we do that under ultrasound guidance as well for accuracy. So the type of stem cells we use is from donated umbilical cord donor, and these are cells donated after the baby's born. So the baby's already healthy delivered. Most of the time the mothers throw away the umbilical cord, but now mothers are starting to donate it where it's sent to a lab, sanitized, and then we can extract the cells that are day zero old, they're very young. We could graft that in your knee, and then we have a special laser to stimulate the stem cells to replicate, regenerate, and repair the tissue at a faster rate, so the stem cell therapy will last for a longer period of time. So we could regenerate the meniscus to repair and grow back and avoid the meniscus surgery, and also prevent any type of knee replacements down the road to get you back into the activities you love. So you want to get back to the gym. Is that your main goal? Okay. Yeah, so what you're going to do is we do get booked out pretty fast, but usually we're booked out a couple of months, but sometimes we do have cancellations, because since we're the only ones doing this on the West Coast, we do have a lot of patients who fly in from other states and countries. But if you do call us, our concierge staff, they could see if there's a cancellation, so they could get you in as soon as you can, because the longer you wait, the more your knees wear out and the more probability that you're going to have the surgery. Okay? Yeah, so that it's already bone on bone, so we've got to make sure that we repair that knee so you can avoid the knee replacement.
Sandy,
Yeah.
Exactly. Sandy, thank you so much for calling. We're going to have to go to a break, but I really appreciate you listening to the show and calling in to ask a question. Before we go to break, let me ask, are you suffering with knee pain? Because you now have hope of reducing or eliminating your pain with a new non-surgical painless medical breakthrough, the West Coast's only laser-guided stem cell therapy. This new treatment may reduce or eliminate your pain in minutes. Imagine new knees in a day. If you have chronic knee pain, attend a special knee pain lunch and learn seminar and learn how this new laser stem cell treatment can give your old knees new life. Start living pain-free. Grab your cell phone now, be one of the next 27 callers, and the knee pain lunch seminar is free. So dial pound 250 and say knee pain, and you'll be connected on your cell phone. Dial pound 250 and say knee pain. And I want to thank you all for listening to Welcome to Living Without Knee Pain. We're going to be right back after the break for one more segment, so stay tuned, and we'll see you in just a minute.